Useful Resources in Primary Care. This series of videos is aimed at junior doctors, advanced nurse practitioners and international medical graduates who are starting their journey in primary care. The videos are not designed to provide a complete list of useful resources, but focus on resources I wish I knew when I started as a GP trainee. In this video, we'll focus on the National Institute for Health and Care Excellence, or NICE, which is the main source of clinical guidance in the UK. We'll try to present practical steps to using their main source of information, their website. What are the benefits of NICE guidelines? NICE guidelines provide practical recommendations based on the latest evidence to guide the management of patients with a specific illness. They aim to improve the quality of care and reduce variability across areas of the NHS. They also help to reduce uncertainty for healthcare practitioners, especially those who are unfamiliar to a speciality or the NHS. It's important to note that guidelines should be implemented as recommendations, taking into account the specific clinical context and shared management with your patient. What does the NICE website include? Today, we'll discuss 4 sections within the NICE website, which I found useful within my practice: NICE Clinical Knowledge Summaries, NICE Pathways, NICE Guidelines, and the British National Formulary. The first section we'll discuss is the area I use the most and find most beneficial, which is NICE Clinical Knowledge Summaries, or NICE CKS. This section includes 370 of the most common presentations and topics in primary care. It includes concise summaries of the latest evidence and practical guidance aimed at primary care physicians. The information is easily laid out and accessible, making it ideal to access during a busy surgery or consultation. Here we can see the summary page for the NICE CKS on sciatica. You can easily access the different sections of the guidance by clicking on the different links on the summary page. As a general guide, the diagnosis section provides information on the important aspects of the history that should be listed, including red flags, examination techniques, and possible differential diagnoses. The management section provides information on the recommended treatment options, how to follow up these patients, when to consider further investigations, and referral to secondary care. Often included within NICE CKS are patient decision aids, which can be useful leaflets to give to patients if they're uncertain during a consultation. I'd recommend to junior doctors and AMPs starting in primary care to become familiar with NICE CKS, as we found it to be very useful within our surgery. The second section we'll discuss today is NICE Guidance. This section can be split into clinical guidelines, technology appraisals, and diagnostic guidance. The clinical guidelines provide in-depth recommendations regarding diagnosis and management of patients with a specific illness or presentation. Technology appraisals provide guidance related to the latest evidence on prescribing, and diagnostic guidance provide advice on the evidence available for using different investigations in order to achieve a diagnosis. The clinical guidelines include a wide variety of conditions aimed both at primary and secondary care. Personally, I find the information on NICE CKS more accessible and therefore use it more often during a busy surgery, and may access NICE guidelines if the information isn't available on CKS. The clinical topics on NICE CKS and NICE guidelines can be accessed through the search bar at the top of the page, or by clicking on the appropriate letter in the A to Z section, or by choosing the appropriate speciality. Thirdly, we'll mention NICE Pathways, which is a recent innovation by NICE for those who prefer a more visual method of accessing the information. By using the flowcharts on NICE Pathways through using the following keys, you'll be able to access all the information that NICE have regarding a specific clinical topic. Here we can see the NICE Pathways on sciatica. One personal tip would be to use the mobile version even when using a desktop, as the information is generally more accessible. By further clicking on these links here, you're provided with more information related to the quality standards produced by NICE. Also, by clicking on these links here, you're provided with further flowcharts for you to explore. Finally, we'll discuss the British National Formulary and the British National Formulary for Children. The BNF and BNFC are widely used in the NHS as an up-to-date, highly authoritative information resource on medicines prescribed in the UK. The book version is published twice yearly, but you can access up-to-date information on the website or through the app. You can search for any drug you're interested in through the search bar at the top of the page. I would recommend using the sections area at the top of each medication page in order to access the information quickly. The BNF and BNFC also include treatment summaries. These can provide supplementary information regarding the pharmacology and effective use of medication within a specific clinical area. You can also access the online BNF through systems used in general practice, such as EMIS Web. There are 3 ways you can access the BNF from within EMIS Web. Firstly, by clicking on the Medications tab and using the Drug Info button, the BNF will open in a new window where you are able to search for your drug of interest. If you highlight one of the medication in the medication list, then press Drug Info, you will be provided with the BNF page on that specific drug. Moreover, you can access the BNF by pressing the Add Drug button and typing in a drug name. Then you're able to access the BNF on that specific drug by pressing the Drug Information button either at the top of the window, which will open a new window, or at the bottom of the window, which will display the information below. I hope you found this information useful. Thank you.